Welcome in everyone. I'm Anna Hedden, and thank you for joining us for episode 3 of the Pathways to Advocacy Conversation series. This series was created to spotlight real change makers in ovarian cancer research and advocacy, and to help more patients and survivors see what's possible when they bring their voice into the research space. Today, I'm honored to be speaking with Dr. Kristin Anderson. Dr. Anderson is an assistant professor at the University of Virginia School of Medicine. She received her PhD in immunology from the University of Minnesota and completed her postdoctoral training at the Fred Hutchinson Cancer Research Center and the University of Washington. During her postdoctoral training, Dr. Anderson learned how to engineer T cells to recognize and kill cancer. Her research lab now focuses on engineering cancer-killing T cells to overcome obstacles in solid tumors. In addition to running a lab, Dr. Anderson is an Ovarian Cancer Research Alliance advocate leader, as well as a board member, advocate program lead, and advocate scientific conference lead at the Powell-Drescher Ovarian Cancer Research Foundation. The list of Dr. Anderson honors is many miles long, but among them are Presidential Award overall winner from the Society of Immunotherapy of Cancer and Women in Cancer Research Scholar Award from the American Association for Cancer Research. Dr. Anderson is a survivor, mentor, and a driving force behind the movement for more inclusive, patient-centered research. We'll be talking with her about what patient engagement actually looks like, what advocates do on research teams, and what it takes to build strong, effective collaborations between scientists and survivors. I would like to encourage you to please drop your questions in the chat, as Dr. Anderson would love to speak with as many of you as possible. Dr. Anderson, welcome.
Thank you so much, Anna. I'm really excited to be here.
Thank you. I would love to begin, Dr. Anderson, by asking you to please share a bit of your personal journey, especially the key moments that sparked your passion for science and research, and maybe what ultimately drew you to focus on ovarian cancer.
Yeah, absolutely. Like lots of people who are in science, I got interested in science and biology pretty early. I was a high school student when I took some really interesting classes that sort of drew me to science. And so when I went to college, I continued studying biology. And the thing that was a really pivotal moment for me was I took an immunology class as a college student, and this was a small class. There were maybe 8 of us. And my professor came in one day and she split us into 2 groups, and she threw a pregnancy test on the table in front of each group. And she said, for the next 90 minutes, I want you and your small groups to figure out how this works. Here's a hint. It's immunology in a box. Go. And the whole lesson, we had to figure out how immunology concepts were being used to make everyday tools that we use in our lives. It was fascinating, and that was a pivotal moment that drove me to say, I want to study immunology because this is just so cool. So I went to graduate school. I did play around with whether or not medical school was the right fit for me, as many people who like science do. And I realized after shadowing in the emergency department at the local hospital that I really wanted to help people, but it didn't feel like the role of a clinician was exactly the right fit for me. So I worked in research labs, and figured that that was actually where I wanted to be. Now, when I started my PhD program, I focused on immunology, and about my 3rd, 4th year of graduate school, I ended up being diagnosed with breast cancer. Which was shocking because I was only 28, and it was a very, very unexpected. So I was able to continue graduate school while getting treatment, going sort of part-time. And then when I finished treatment and ultimately came out with a diagnosis or a final assessment that I was disease-free, there was no evidence of disease after my chemo and surgery treatment, I decided that what I really wanted to do was pivot into research that involved using the immune system to kill cancer, so that I could make that diagnosis and experience that cancer journey and that outcome something for other people as well. So,
Well,
and then you asked about ovarian cancer. What made me
yeah,
pick ovarian cancer?
yeah.
When I found the place I wanted to do my postdoc training, I was really passionate about women's cancers in particular. And I was learning about how few treatment options there are for ovarian cancer patients after the frontline chemotherapy and targeted approaches, and that immunotherapy didn't really work very well for ovarian cancer. And so that seemed like a really good opportunity for my research efforts to try to figure out how we could make that a reality as a treatment.
Yeah, remarkable. Just listening to your remarkable resilience, Dr. Anderson, at just such young age, graduate school cancer. So first and foremost, so great to see you healthy and well. And thank you for sharing that. Thank you for sharing that journey. The jump, though, how do you from immunology to advocacy? Like what led you to become involved in advocacy, whether legislative or research focused? And again, curious, was there a pivotal moment in your career or during kind of your own experience that inspired that path?
Yeah, so when I was a graduate student, I remember talking to my family about what I was doing and what I was working on. And specifically, I had been working in a lab that required me to come in over holidays and the weekends to basically feed my cells and to keep them alive in culture. And my family just didn't understand. Wait a minute, you're going to leave Thanksgiving dinner to go to the lab? Why? Like that concept of what was really going on was really hard. So I recognized there was sort of a gap in understanding between what I was doing and what people understood me to be doing. So I spent a lot of time thinking about how to help communicate what are we actually doing in the lab and how hard we're working and why it was important. Another thing that really influenced my decision to be involved in advocacy was the fact that NIH funding literally saved my life. So when I was diagnosed and when we made my treatment plan and we figured out what chemotherapy agents I was going to get, my husband and I, who are both scientists, went back in the NIH archives. You can actually look up every NIH grant that was ever funded. And he found, I should give him the credit, he found the one that funded the initial studies that led to the targeted chemotherapy agent I got. Because as a BRCA1 mutation carrier, there's specific drugs that you can take that are more effective than others. And so that grant that was funded in the 1980s. And I was receiving the treatment in the 2010s. So 30 years later, this initial NIH grant had led to medicine that saved my life. And that link, while many industry partners funded the research in between in those 30 years to bring it from that initial discovery and the biology to something that I could have in the clinic, that foundation may never have happened if the NIH hadn't given that initial seed funding to get the project off the ground. So knowing and seeing those connections was just that much more of a spotlight on how important it is to advocate for funding for basic scientific research. So I advocate on Capitol Hill because funding for the NIH really has not kept pace with inflation over the past 30 years. So even though Congress has increased funding for the NIH steadily over the past 10 years, when you adjust for inflation, the amount that was appropriated, for example, in fiscal year 2025 is technically lower than what was appropriated in 2005, 20 years ago. Again, if you adjust for inflation. So realistically, if the US wants to stay at the forefront of biomedical research and truly be a leading place in the world for science and medicine, we have to dramatically increase NIH funding.
As I was listening to you and I was kind of writing down for just for myself and thank you the numbers. So thank you for sharing this kind of eye-opening funding levels. And most importantly, thank you for your legislative advocacy. It's there are always three parts to it, isn't it? There is the science, there is the patient, and there is policy. And without policy, nothing moves, and it's policy that translates into funding. So So that legislative component is absolutely key. Thank you again. These are very eye-opening numbers, especially when you're looking back historically in comparison. Your advocacy with the Powell-Drescher Ovarian Cancer Research Foundation. Could you speak a little bit what led you to your involvement with the foundation, and how did that connection come about?
Yeah, absolutely. So when I did my postdoc, I moved out to Seattle and I was working in an immunology of cancer, like a translational immunology lab. And because my project was going to be focused on ovarian cancer, my mentor, who was not an ovarian cancer expert, had connected me with several folks in the area who were ovarian cancer clinicians, researchers, and experts in the field. So Dr. Charles Drescher was the person I was connected with first. And he was really instrumental in helping me to get the lay of the land, learn about the field, the state of the ovarian cancer research field, and to help figure out which preclinical models were the ones that I could use in my studies to most effectively reflect what was going on in ovarian tumors. So I met Dr. Drescher very early, and he became a mentor to me very early on in my research career in ovarian cancer. And then early on, I also got connected with a foundation called the Rivkin Center, and they were very instrumental in getting ovarian cancer research funded, especially in the Seattle area, for many, many years. And they had opened an education component where they were trying to raise awareness about ovarian cancer in the community so that people with ovaries, women, could go to their providers and say, here are these things I'm experiencing. I want to talk about ovarian cancer. And through that process, I got to meet Sasha Powell. And at some point, we decided to go to lunch just to chat and connect and reflect over our experiences. And we had so much fun over that sushi lunch that we sort of figured out we were going to be friends forever. And when Sasha and Dr. Drescher decided to start the foundation, they invited me to be part of it. So here I am.
Well, again, listening to you, the only thing that's typical about your journey is that it's not typical, right? So sushi lunch, and so, let's stay. The Powell-Drescher Ovarian Cancer Research Foundation is just kind of very close and dear to my heart, and for a number of reasons. But just I would love to really focus kind of on the core mission, which is to foster really collaboration between scientists and survivors. And since you are actively engaged with patient partners in your research lab, you're in a unique position to speak about it, and you're the right person to ask. What are some of the real benefits you have seen when cancer patients and advocates are meaningfully included in the research process?
Absolutely. The benefits are multifold. I think first and foremost, advocate voices really help researchers to make sure that what they're focused on are the most important questions. If you think about how research is portrayed on TV, a lot of us have an image of someone pipetting brightly colored liquid from one tube to another, but the actual act of pipetting and doing work in the wet lab is only maybe a third of our time and what we are actually focused on. The majority of what we do is spend time thinking critically about the problems, the questions, and how we can address those problems and find solutions. So essentially what we do is we read the literature. We try to figure out what's already known, and we identify a problem. So for example, we have some treatments for ovarian cancer patients right now, but if someone's tumor becomes resistant to the current agents, we only have a handful of other options that work to varying degrees to help those people. So we need more therapies. So what we start to do is dig in the literature to understand what are some of the things that have worked, and for the things that have not worked, what do we understand about why they haven't worked? We read, we think, we come up with ideas. You may have heard the phrase, we come up with a hypothesis. But the important part is that we come up with a testable hypothesis, something that we can design an experiment with controls so that we can interpret the outcome. And what's really important is when we design that hypothesis to address a question, we don't want to be asking a question that's only important for a mouse model of cancer or another preclinical system that could potentially be an artifact. We want to make sure that the questions we're asking are important and relevant and going to be positively impacting the outcomes and lives of patients. So having advocate voices simply be involved in the conversation to ask questions like, how do you see this impacting patients? Can reorient the way that scientists think about their work to make sure that they don't go off on tangents, that they instead are bringing everything back full circle. Everything funded by the NIH is intended to help people and directly benefit human health. And the road that connects the science to those benefits may be long, windy, or indirect, but we scientists really benefit from continually reflecting on what that connection is. The other thing that I have found to be incredibly helpful is, for those who are not aware, if you don't work in a lab or you aren't in scientific research, it's really, really hard. So once we determine what question it is that we want to ask or problem we want to address or pursue, we spend a lot of time coming up with that testable hypothesis, designing experiments to test it, and figure out if our idea is right or not. And most of our time in the wet lab is spent optimizing conditions, setting up the experiment, making sure that when we do the actual test, all the data will be interpretable and we will get a real outcome that we can use to move our knowledge forward. And sometimes that optimizing doesn't look right, and we have to go back to the drawing board and figure it out. Or maybe there are some controls or conditions where things didn't work out the way we thought they would, and we have to go think about stuff or optimize again. And that can be really exhausting. And it can be deflating if you spend all this time trying to get something to work and you're still not getting the results that you need. So having an advocate voice there to remind us we value what you're doing, like we really appreciate how hard you're working, that can be incredibly uplifting on the hard days when, so Anna, as you and I were talking at the top of the hour, I was in this weekend working on a grant, and several of my students were in the lab working on the weekend. When scientists give up their free time, their time with their family, their time with their friends, their time to rest, to put extra effort into trying to solve these problems, and it's not working or they're having a hard time, hearing basically cheerleaders who are saying, what you're doing is really important. Thank you for working on this. It matters. Another way that we have found real benefits from working with advocate partners is turning around what we have found and communicating it with the community at large. So the vast majority of the work that we do is funded by taxpayer dollars. And that means it's our responsibility to communicate how that money is being spent. Now, when we scientists are going through training, one of the things that we learn over and over and over again is the vocabulary, how to very specifically talk about the concepts and ideas to accurately convey the incredibly important properties under what we're doing. And so experts learn these very niche jargon terms in order to communicate with each other exactly what we're doing. And that can be really important once you get into specialty areas to be able to have those very technical conversations. However, we have to unlearn those skills or simultaneously learn how to then take those concepts and remove the jargon and explain the high-level important ideas to people who don't have that vocabulary base. And one of the ways advocates have really helped us do that is not only to help us take our key concepts and help us identify the jargon and find different words that effectively mean the same thing, but that are accessible to the whole community. But they also help us spread our information. So people who have platforms on social media or who are out interfacing with the community can talk about the cool science that's coming out and really inspire people who may not have a connection to scientists or research to say, hey, did you know at our local institution, here's what they're working on and here's the cool thing they're finding. That extra help to really convey our research and how much forward movement we have is invaluable.
Well, you focused on 3, but I'm hearing 4 themes. Let me see if I got that right. So what do patients, what's the role of the patient? Focusing science on what is important,
Mhm.
spirit support,
Yeah.
mental toughness, and dissemination. Did we get that?
Yeah, yep, that's right.
Thank you. Thank you for sharing that. That was very comprehensive and kind of piggybacking on that, on your answer. One of the most common questions that I've personally encountered when talking to advocates and those who are, especially those who are considering working on research teams, the question is, what do advocates actually do? They understand, yes, being on the team is very, very cool and exciting and new and can be new, but what do advocates actually do? So again, kind of from your experience, if you could share some examples of patients and how can patients and advocates be meaningfully involved in the actual execution of the research?
Absolutely. So the first time I ever saw an advocate contribution really completely reframe how scientists were thinking about their work was when I served as a consumer reviewer for the Department of Defense. I was on one of the grant review panels, and I was still very early in my scientific training at this point, and I had the opportunity to be there to assess the impact this research was going to have on the breast cancer community, not so much whether the science was being done correctly or anything like that. And I remember a scientist in the room had basically explained the grant, here's their goal, and they had discussed the quality of the science, et cetera. And they were about to vote on scores to figure out, should this grant be funded? And an advocate in the room said, from what I understand, all this work is being done in a dish. But what you said was that this particular drug they're working on targets a process that probably happens in all cells in the body. So what have the scientists done to show that this agent is not going to be toxic if it's given to a person? And the room was silent. And so this advocate didn't have any science training. They didn't necessarily know all the jargon, but they understood the high-level concept enough to ask a critical question. And I looked around the room, and the scientists were so quiet, and they revised their scores. And that grant did not score as well because of something the advocate had brought up in that conversation. So advocate voices absolutely matter to making our research better. Now, the way that I see it enacted most regularly in practice is by participating in the clinical research space. So when we do clinical research, this is when we are designing trials to basically have patients volunteer to participate in a trial and help us figure out the efficacy and safety of new drugs or new treatment modalities. Now, in terms of patient participation, there are patients who actually receive those treatments, but before anything ever gets to a cancer patient, we have to actually design the trial. Who is going to be able to participate? The consent forms that would actually be given to a patient so they know what's going to happen through every step of the trial. And all those patient-facing documents, we have advocates who help us make sure that the language we're using is clear, that the concepts make sense, that a person who were reading this for the first time would be able to fully understand what they're signing up for. So that's a really critical part of advocate involvement in research. In addition to that, we have advocates who help us figure out whether or not the criteria we use to determine if people can participate is inclusive. I remember hearing a story where there was a scientist who was going to start a clinical trial, and it was about a chemotherapy agent. And so we call it inclusion criteria, the things that you have to check the list to be able to participate in the trial. One of the inclusion criteria was you have to get your chemotherapy IV. And they were doing a listening group asking advocates, what are the things that we need to modify about this trial design? And an advocate said, well, I don't get my medicine IV. I take pills. I get it orally. So does that mean that I'm not eligible for this trial? And the doctor did a complete, oh my gosh, we are excluding a whole group of people who really should have access to this medicine. And they changed the design of the trial. Just that one inclusion criteria then opened it up to way more people. So those are a few examples of how simply asking a question can be really, really pivotal to making our research better. Now, on the bench side, so the science that we do in our lab, we're really trying to train our students how to communicate both using the scientific specific language, but also to convey their science accurately to the rest of the field and to share their work not only with the research community, but with the community at large. So even though my lab is newer, all my students are encouraged to work with non-scientist partners to figure out how to accurately and clearly explain their project. So having advocates who come to our lab meetings, even if it's virtual, can really help us to figure out which words are we using that are not clear.
Yeah, again, you never cease to amaze me. Every time I work with you, I come out with tons of notes but these are such critical points, because I'm just looking at everything that you covered, and just the ability to communicate science to non-expert audience. It is so key, and it comes around full circles, because then advocates can in turn translate science to the public. Yeah, right. And then not only does it lead to a more relevant science, but it also leads to better policy and funding by extension. So these are, thank you for sharing that critical information. And I'm just curious if you could share, again, going back to your experience, if you could share an example of a time when a patient partner influenced your or your team's decision making, or perhaps helped you see an issue from a different perspective.
Yeah, so we're writing our clinical trial right now, and we have an advocate partner who is actually helping us with all of the patient-facing documents. And for example, when we write our grant, we have to try to communicate our science in what's called a lay abstract. So we have a technical abstract that's got all the science jargon, and then we have a lay abstract that has none of the science jargon. And so every single time I write a lay abstract, I have an advocate partner help me read through that, make sure that it's clear and that the concepts make sense, that there's nothing confusing about it. And one of the things that we've really done is start to, in all of our budgets for our grants, include a line where we ask for an honorarium to support that advocate partner financially. I think one of the things that I have learned is that so many advocates want to help. They want to be part of this process, but we are asking for time and energy. And as scientists, we get asked for our time and energy and unpaid labor a lot, but that doesn't mean that it's okay. And so we should, whenever possible, be trying to give an honorarium to support the advocate partners for all of their contributions to making the science better. Other ways that people have specifically helped us, the other new one is that just getting the communication about our work out to the public. We have had lots of help from advocate partners. We have a new project, for example, where our findings just got accepted in a journal called The Proceedings of the National Academy of Sciences. And so when that comes out, it'll be all over social media, but it'll be in the circles that are just scientists, right? So that we communicate the newest findings to each other. But I think one of the missed opportunities is taking that science and then spreading it in the general community too, and saying, look at these new findings that are coming out on the basic research side. It's really important for us to amplify, elevate, and support this so that we can take these preclinical studies that aren't in people yet and help them make their way to people. So having partners in the communication realm has been super helpful.
Yeah, I was smiling when you brought up the compensation for advocate partners, and we don't always like to talk about money, but when it's for the good, I think we should. And kind of in addition to what do advocates actually do, this is the second most common question or the issue or point of discussion, and kind of reimbursement and compensation, which is not the same thing, but But what I've found out kind of in my personal discussions that for advocates, it's not really about the dollar amount. It's more about recognition of the partnership, but also a way to support their advocacy, be it travel or conferences or fees, anything that support advocacy's activity. So that is thank you so much for being the leader, so that the patient partners don't have to ask. So that's another big thing, and something else that comes up in the conversations about patient engagement, and that is that there aren't really any clear frameworks for collaborations. And that researchers aren't really trained to work closely with cancer patient and advocates. Going back to your experience, what advice would you give to research community to build stronger partnerships with patients?
Yeah, that's a wonderful question. And I actually have been digging into this a little bit more to try to figure out what the barriers are to this engagement, because there have been many people for years shouting from the rooftops about how these partnerships are so instrumental to making science and research better. There's just a disconnect. And one of the important truths is that these collaborations, first and foremost, are built on trust. And they are that. They are relationships. And as everyone knows, relationships take time and energy, both to build and establish trust and to maintain relationships for extended periods of time. So as researchers and scientists, we work long days, late nights, the weekend, and asking researchers to give up more of their limited time and energy that they could be using to rest, connect with family and friends, avoid burnout. That's been challenging. But I think it's incredibly worthwhile to put that effort in. And so as a member of a very small community that wears both hats, a scientist and a survivor, I have kind of a unique window into why that connection is so important. And so I think one of the big things that we can do as scientists and people in the research space, especially for those who are in leadership at major research centers, universities, research hospitals, would be to find a way to really incentivize research efforts in this area. So, for example, if institutions could find a way to measure the quality of a researcher's community engagement and consider that as an essential metric when someone is being considered for promotion and tenure, then more researchers would be incentivized to allocate significant time and energy to just that, building and maintaining those relationships and having ongoing communications with the community more generally. In the meantime, for those who are just at a comprehensive cancer center and want to get started, any comprehensive cancer center has a community outreach and engagement office, and the folks who work in that particular division should be able to help find local advocates who are excited to support research, and vice versa. If you're a community member and you want to get involved, find the nearest cancer center that has a community outreach and engagement office and let them know you're excited, because that can be a link for everyone who wants training and access bidirectionally. So, but I guess you asked this question, Anna, and I kind of want to turn it around and ask you, because you have been a patient and a research advocate, and I want to know from your experience if you have wisdom or insights about this scientist-survivor collaboration that you think the research community could really benefit from.
The question makes me smile. This is why you're such a champion of scientist-survivor collaboration, Dr. Anderson, because you never pass up a chance to ask a patient what's the patient perspective is from the other side. And oh gosh, like patient engagement, that is such a passion of mine. And it's a big topic, right? It's a big in impact and big in scope. And I feel like we can do an entire series just on subject matter alone. But I'll give you kind of two points. And one is general and one is that comes to mind just pertaining to ovarian cancer. This one one advice that, and again, we're talking about advice to the research community, right? Not the patient. And one really good piece of advice I heard and I liked it, and it came actually from one of your colleagues at ASCO, American Society of Clinical Oncology, in the meeting in Chicago a couple months ago. And there was a Conca Cancer Foundation had a wonderful panel of patient engagement. And the message from the researcher to the research community was the following, and I remember it like it was yesterday. If you find it difficult, if you find it challenging to work out the issues with the patient partners, whether it's a language, whether administrative, whether it's logistics, what the message is, this is more of a reason to do it. Find a way to overcome it. Find a way to work all of those logistics out, because ultimately it will elevate the level of your research and it will elevate the level of the team's work. And I just remember that kind of very passionate plea: take the advocates however way you can get, take them old, young, experienced, novice, it doesn't matter. Just really embrace the opportunity to have a patient advocate on your team. And I like that kind of as a crucial foundational base for collaboration, because I really feel that sets the tone on a kind of on a macro level. And but bringing it back to ovarian, and that's something that kind of I've personally always felt very strongly about, and that is that ovarian cancer is really in the category of its own. And I mean it with utmost respect to all other cancers. My mom passed away from leukemia during my cancer treatment, and my dad got diagnosed with colorectal cancer. So I'm coming at it from four cancers, having navigated four cancers at the same time. So kind of I'm coming from a broad overview. And the reason I'm saying that ovarian cancer patients and survivors are sort of a special group is because very, very few of us are truly lucky and fortunate to be able to be completely removed from treatment, whether it's maintenance, recurrences, or otherwise. So what we choose to give our time to, I feel, becomes very, very precious, because we measure our time differently. So I guess maybe not the advice, but my wish for the research community is to have that understanding and to be that a foundational tenet of the patient engagement philosophy in ovarian cancer. And I believe that once that recognition is set, once that understanding is baked in, I feel that all other issues where compensation, reimbursement, logistics, et cetera, I think all of that finds a way to be worked out much more effectively. But I can, yeah, that is, I'm so glad that you brought it up. Again, that's a huge passion of mine, and I can speak to you for days, but I'm taking too much of your time, and your break is up, Dr. Anderson. You're back at the mic. So, so we have to move on, and wish I had you for days. But on the other side, let's stay on that topic though. On the other side of the scientist survivor collaboration are the patients. So looking back on your experience, what are some of the key challenges or barriers you have seen patient partners face when participating in research? And the other part of it, would like to ask you, how can research teams help minimize those barriers to create more supportive environment for patient partner?
Yeah, there are numerous barriers, and we don't have time to discuss all of them in the depth that they truly deserve. But I will highlight two critical ones that we've encountered. I alluded to the first one before, and that's trust. There are some communities that have truly been harmed by the medical community and researchers in the past, and those injustices really deserve to be acknowledged and require repair. So for researchers who work with those communities, it's really important to take the time and the energy to build that trust. And we as researchers need to be able to hear communities who are willing to have those conversations with us and educate us about those injustices, and sit in that discomfort and do the work to start really repairing those relationships. Another major barrier that we've encountered is simply, as you alluded to, logistical. For example, my lab meetings are Tuesday afternoons, and many community members have other obligations. So they may have caregiver responsibilities, they may have work. If someone is still in treatment, they may have medical appointments that they need to go to. And all of those things could prevent them from coming regularly to our lab meetings and hearing about our science weekly. So what we've done is we've set up a hybrid lab meeting. So our team who's physically here meets in person, but we have a Zoom component set up every time. So then anyone who can't physically be here, whether that's a lab member or an advocate or a guest speaker, they can actually still engage with our lab meeting and log in and participate wherever they are, whatever time zone they're in. And then, like I alluded to before, we also try to request funding on all of our grants that involve patient advocate partners to make sure we can give them an honorarium as a thank you for their time and energy that they are contributing to the project.
Yeah, that's excellent. Thank you. Thank you, Dr. Anderson. And I'll come back since we're staying on the scientist survivor collaboration and patient partners. Any advice, but this time, any advice or wisdom you would offer to patient advocates rather than research community, patient advocates who are already involved in research or who are maybe thinking about it, getting involved in the future?
Yeah. There's a great urgency to make the science move faster, but it doesn't move very fast. So please be patient with us, both with how slow sometimes science can progress, but also with our ability to learn how to communicate without all the jargon. For a lot of us, it's not a natural part of our training. Despite all of the things we are trying to learn how to do, that has not historically been an integral component of graduate research training. And so we don't always think about it. And we're trying to change the culture. There are actually more of us than I really appreciated who are trying to push the boundaries, change the perspective, and do things like always ask for funding for our advocate partners, to do things like always update our advocate partners about the progress of the grant. Say, for example, you help review a lay abstract for me and we submit it, but at the end of the day, it doesn't get funded. You might sit in limbo wondering, whatever happened to that project? What's going on with that? Did they need me? Did they not need me? So we need to get better about simply communicating even when it's not great news. And that can be hard. We can be embarrassed and disheartened, but we need to be better about fully communicating. We need to be a little bit better about being respectful of advocates' time. Often, because there are so many deadlines and things weighing on us, we are doing things last minute. We're flying by the seat of our pants, just trying to get things in before deadlines. And sometimes we don't fully plan out how much time we might need to get input from someone else. So there will probably be researchers who turn something around and say, hey, can you look at this and give me feedback in 2 days? It's certainly not ideal, and we need to unlearn that behavior, especially when we're interacting with advocate partners. But be patient with us as we change the culture and learn or unlearn bad habits. Some of that isn't going to come naturally. But also, please don't hesitate to reach out to us and ask how things are going. Ask for updates. Hey, did you ever get that grant? Hey, do you have any new exciting data that's coming out? I'd love to hear what the progress is. Can I have an update? Sometimes we just forget and we only talk to the people who are physically in the room with us all the time. So please remember, you have incredibly valuable insights that you can contribute through the whole process, all along through the whole pipeline. So please don't let jargon stand in your way, and please reach out if we forget to.
Yeah.
So again, I'm going to throw it back to you. What advice do you have for fellow advocates who want to get more involved?
Somehow I had a feeling that you're coming for that, and I'm really I'm really glad that you brought up communication again, as I'm taking notes, and communication comes along, and I guess one advice, again, keeping it general, again, from my experience and from my perspective, is to not be intimidated or afraid to ask for what you need. So just because you're on the team doesn't mean that you expected to know everything. So if it's a language, don't feel like you have to understand everything. Ask, because it's ultimately on the research community to make the language of their research understandable to you. And let's say if you are, just an example, involved at the stage of, well, let's say expression of interest, and somebody comes up and asks, could you provide some notes? Sounds great, but what kind of notes do you need? Is there something in my background that may make your application stronger? What kind of notes do you need? Or is it the language that perhaps I can help to make the impact more impactful? So just asking, and by the way, how much space do I have, right? Because sometimes those applications are limited to words and pages. So before you start working all of that, again, don't feel intimidated and just ask exactly what is it that you need. And the second, I guess, in the second part, again, kind of going back to the confidence intimidation, is to kind of be upfront if you are perhaps a novice advocate, but you would like to get involved. Ask to be paired up with a more seasoned veteran, because then you can cut your teeth by learning with and from others, and then kind of build your confidence and skill set that way. So these are kind of in general broad terms would be kind of top two that comes to mind. But we have to, Dr. Anderson, again, we have to move on. I would like to shift gears slightly here, but stay on the topic of advocate involvement, and going back to Powell-Drescher Ovarian Cancer Research Foundation. So one of the goals of the foundation is to attract, inspire, and develop more ovarian cancer advocates. And that's not only to promote research in general, but to actually support scientific community more directly, such as you mentioned, late abstract reviewers or patient partners on research team. And confidence, right? I mentioned confidence. So one challenge that often comes up for patients is the confidence to engage with science and to engage with scientists. And I feel this is where you, Dr. Anderson, along with the foundation, give so much of your time, commitment, and heart to really educate and prepare advocates for meaningful engagement. I would like to ask you if you could speak a little bit as to what drives you to that type of mentorship, that kind of mentorship, and for those new or prospective advocates, what that preparation or training actually looks like.
Yeah, I mean, I think the thing that drives me is that I know how important the insights and perspectives from people who have experienced cancer, people who have experienced a treatment journey. I know how important those voices and insights are. So that's what really is pushing me to make sure that for people who want to participate, we try to remove the barriers to that participation and engagement. So the first thing we often do when we're talking about helping advocates get into the research space is we talk about how to tell your story. We help you find your voice and try to help you realize that the things that you share through talking about your experience can be really educational for the scientists. For example, the people in my lab who are learning or getting their PhD in scientific research, some of them have no exposure or experience with what the treatment journey is like, for example, for an ovarian cancer patient. Learning about obstacles people have to go through just to get certain diagnostic testing done, learning how long they sometimes advocate to try to get a diagnosis even, learning about the side effects of some of the medicines that we have. All of that can be brand new to people in the lab, even though they're working on ovarian cancer research. They may not know these things. So hearing about your journey is super valuable. The other thing we take some time to do is talk about what research actually looks like. Like I said at the beginning, it's hard and really long. And if you've never taken science classes or, been in a research lab yourself, it can be really hard to understand just how everything fits together and how long it all takes to get to something that's in the clinic and the final thing that's helping people. So once we sort of establish that common ground and we identify what are our common goals, that can really help build the conversation and give both sides the confidence that they need to have conversations about it.
I remember you, I was again smiling. I remember my training with you, and one of the training was the kind of learning to tell your story, and you referred to it as an elevator pitch. And I remember one of the first conferences that the Powell-Drescher so graciously awarded me an opportunity to attend in Boston, the ovarian cancer. And I ended up, it was the last day of the conference. And oh gosh, I thought about you. And I don't think I ever shared in person. But I ended up, I think it was Dr. Kathleen Cho from University of Michigan Medical School. And she was delivering a closing keynote. And it was the 10 minutes before the keynote, and her and I, we found ourselves literally in the elevator going down, and she kind of looked at my badge and she asked me a question, and at that moment, I was just excited I was not the one cutting it that close to the keynote, and I was not the one delivering address. So, but that training, and so here is my Dr. Anderson elevator pitch, and I'm literally in the elevator with Dr. Kathleen Cho. So again, for somebody who is a seasoned veteran, that may not seem like a big deal, but if you're just entering the arena, just to be able to kind of capture your story succinctly in 1 or 2 sentences in front of an expert audience could be utterly intimidating. So thank you for all the training, and it's just absolutely invaluable. And speaking to that training and mentorship, what do you find most fulfilling and rewarding about this work, whether personally, professionally, or both?
The people, hands down. I have made so many new, amazing friends and learned so many incredibly impactful stories through this work. Absolutely the people.
And looking at the arc of your advocacy journey, what are you most proud of, and what would you consider your greatest achievement so far?
I think I'm most proud of how many advocates we've been able to connect with scientists so far. I think that achievement, growing this network of people who are truly engaging together to try to make research better, is probably one of the things I'm most proud of. Now, we have a long way to go, but I'm proud of how far we've come already.
Yeah, the connection, advocacy, and patient community, and that's just, again, a little bit of a kind of personal perspective. I truly feel that's where the footprint of the Powell-Drescher Ovarian Cancer Research Foundation goes far beyond simply saying scientist-survivor collaboration, because you, Dr. Anderson, and the entire team at the foundation are truly investing your time, skill, support, resources into developing that next generation of ovarian cancer advocates. And that doesn't just strengthen the advocacy arm, but it actually supports and uplifts, if you will, the research community as well. So from my perspective, that impact is truly remarkable. And what you and the foundation are doing, literally one advocate at a time, is a powerful investment in the future of ovarian cancer research and advocacy. So from the heart, thank you sincerely. And looking ahead, what kind of impact do you hope to make in your field and in ovarian cancer advocacy?
I mean, I hope that the stuff that we are researching in the lab will someday make it to clinical trials and then make meaningful improvements in patients' lives. But specifically regarding advocacy, I hope someday that every grant that is written has an advocate partner as part of the research team. I hope that we can really shine a light on how important advocate voices are in making research better and help find actionable solutions to the barriers that are currently in the way and preventing those regular collaborations and partnerships from happening more naturally.
Yeah. And that would be, that would be fantastic, because I'm listening to you, writing everything down, and I feel like you can be a true leader kind of in developing those much needed frameworks for future collaboration. So that's very exciting. And speaking about collaboration in science, what is your current state of mind when it comes to cancer research in general and ovarian cancer specifically?
Honestly, I'm really optimistic. The more that I go to conferences, the more that I grow my network in my community, both my advocate community, but also my research community, I realize there are more and more scientists recognizing that ovarian cancer poses some pretty unique challenges. And there are more and more people working on developing effective therapeutics for it. So I have a lot of hope that once we hit that critical mass of people all working on this problem together, we're going to make significantly more progress. The hive mind tends to be way more efficient than people working separately in silos.
And what gives you hope?
Seeing how many people care about this problem.
Yeah.
We need to find real treatments that can lead to, dare I say, cures.
And as a patient, that's really encouraging and hopeful to hear. And as we approach September, Ovarian Cancer Awareness Month, on the subject matter of hope and advocacy, what do you think we as advocates can do better, differently, or more boldly to kind of help elevate the sense of urgency around ovarian cancer?
I would say please keep staying as visible and as vocal as possible with your advocacy. Every call to a legislator, every postcard, every office visit, every social media post, every single one matters. The more our representatives hear how important research is to you, their constituents, the harder it becomes to ignore. Plus, you never know who's going to see your post or hear your story and hear something that sounds familiar, that either they or a loved one are experiencing. And that might be the spark that someone needs to start their own advocacy journey, or to inspire someone to maybe go talk to a primary care provider about something that they're going through that should be checked out in a little more depth. Who knows? Maybe you can help someone catch ovarian cancer much earlier, and you could save lives just by sharing what you know and care about. It all starts with awareness.
Yeah, and awareness, I would add, not just in the general population, OBGYN community, but in emergency medicine, from on primary care, nurses, physician assistants, just the only when awareness is truly spread, in my view, across the healthcare system, do we stand the best chance to detect this devastating disease early. We're coming up to the top of the hour, Dr. Anderson. I wish I would love to chat with you for days and days and days, but I would really love to, I would love to thank you. I would love to thank you not only for so graciously giving your time, but thank you for your skill, for your mentorship, for bringing women into science, for developing advocates. Like every time I get a chance to work with you, I always come out with a nugget, with a practical skill. You always bring up that next big vision, and that is very aspirational and hopeful. But most importantly, I would like to thank you as a patient, because I'm as someone who is undergoing second recurrence, it is scary, because you realize that the options, the protocol treatments are really shrinking from very limited to virtually non-existent. And then you very, very crystal clear realize that the only path forward and the only hope we have in ovarian cancer space is research. There is no second or third way. There is only one way, and that is cancer research. So on behalf of patients, caregivers, families, I cannot thank you enough for everything you do. And if AACR, American Association for Cancer Research, is ever looking for ambassador, please send me the nomination form, because I can't think of a more passionate and dedicated patient-centered advocate than you. So any parting words or words of wisdom you have for our community, Dr. Anderson?
I want to thank all of you, because I think we do a better job when we work together. So thank you to all of you who already are on a research advocacy journey and partnering with scientists to help us do better. And thank you to those of you who are just getting started and are building up that courage to start the conversation and say, I want to be part of this, because we need you.
Thank you, Dr. Anderson. Thank you so much. And before we close, one more thought. The idea behind our Pathways to Advocacy conversation series was born from a simple but ambitious goal: to spotlight extraordinary individuals who are not only pushing the boundaries of ovarian cancer research, but who are also expanding the space by encouraging all of us to lend our voices. There is no doubt that Dr. Kristin Anderson, along with our previous esteemed guests, Sasha Powell and Dr. Ronnie Drapkin, are true changemakers. But the truth is, the real changemakers are also all of you. Every time you show up, every time you speak up, every time you speak out, You are making a difference in research, in advocacy, and in the lives of those affected by this disease. Please know that every word of every one of your stories truly matters, and no action is too small. Thank you for everything you do. We also cannot thank you enough for your support of the Powell-Drescher Ovarian Cancer Research Foundation, its vision and its mission of active and impactful scientist-survivor collaboration. And we invite you to stay connected with us. Please follow the Powell-Drescher Foundation on social media to hear about future research updates, advocacy events, and opportunities to get involved. Your voice is a vital part of this movement because we're stronger and better when we're together. Thank you again for being here. And until next time, let's stay well together. Goodbye.
Thanks for coming, everybody.
Thank you.